So next question 82. Which following responses are not forbidden during therapeutic communication? Option A, asking close-ended question. B, giving advice. Option C, reflecting and clarifying. Option D, arguing and judgmental response. So that will be option C. Because जो other three option है ना, those are not the components of therapeutic communication. See, only option C is therapeutic. So response given into option C should not be forbidden. Which of the following shows that nurse is listening to the client? Option A, turning away from the patient. No. Nodding and making eye contact. Yeah, that is the thing. Okay, that is non-verbal communication, kind of gesture. This is called gesture. Looking out of the window. No. Checking the patient's case reports. No, that is also not a thing. So basically, and sometimes silence also. So nurse is listening to the client. How you will know? That is making eye contact, and sometimes, like when it is necessary, she is nodding her head. Okay, now careful noting what client saying and observing the client's non-verbal behavior called listening. Response of nurse which shows that nurse is listening are eye to eye contact, nodding and gesturing. I have already told. The same thing also written in description part. 84. Nurse observes the patient to be withdrawn and crying and conveys to the patient that he seems to be sad today. The interviewing approach used here is examining, clarifying, orienting and reflecting. So that is reflecting, because patient को observe कर रहे हैं ना कि पेशेंट क्या रिफ्लेक्ट कर रहे हैं, वो उसके हिसाब से नर्स इज टेलिंग, राइट. से नर्स ऑब्जर्व्स, हियर इट इज टोल्ड दैट शी इज ऑब्जर्विंग द पेशेंट टू बी विथड्रॉन and crying and conveys to the patient that he seems to be sad today. And the interviewing approach it is used here, that is called reflecting. See, directing the client's question or statement back to the client for consideration called reflecting. Now example of non-therapeutic communication, that is validating, belittling, reflecting, listening. So that will be belittling. Okay, because all other three options are therapeutic communication component or techniques. Hope it is clear. See, some of non-therapeutic techniques are closed-ended question, judgmental attitude, false reassurance, giving advice, why question, disapproval, approval, disagreeing, belittling, cliche, challenging, changing the subject, etc. These all are the non-therapeutic techniques. Misjudging the degree of the client's discomfort and lack of empathy which cause the client to feel unimportant called belittling. Okay, which is a non-therapeutic communication technique. Which of the following communication techniques should be avoided by nurse? Again same, that is belittling. Next question, that is 87. Which of the following is an ineffective or non-therapeutic communication? Option A, judgmental attitude. Option B, silence. Option C, focusing. Option D is informing. So that is again judgmental attitude. If you are showing a judgmental attitude, मान लो patient is alcoholic, okay, and you are being judgmental, okay, to the patient because you are not who like alcoholic person, and you are showing that judgmental attitude to the patient. So that is non-therapeutic communication technique. Now 88. Which of the following is a barrier to therapeutic communication? Option A, focusing, restating, giving advice and listening. So here giving advice is a barrier. So we should not give advice to the patient. We can tell like whichever options are available in health sector, and from that patient may choose, but we are never giving advice to patient or patient party. Okay, because patient or patient party should choose what is good for them. We can only suggest. Then next question, one of your colleague states that your assigned client looks like a drug addict. Which of the following best describes your colleague? Option A, introvert. Option B, judgmental attitude. Option C, extrovert. And option D is prejudice. That is C. So option D will be the correct answer. Prejudice. A preconceived judgment or opinion formed without factual knowledge called prejudice. Okay. 90. Mr. Rao, a 56-year-old male, expresses to a nursing officer that he is feeling nauseated after consuming a pill. Nursing officer says, surely you don't think I gave you wrong pill. Then the communication technique used in the above situation: option A, rejecting. Option B, passing judgment. Option C, probing. Option D is challenging. Okay, matlab here that nursing officer is challenging, right? See, surely you don't think I gave you wrong pill. matlab इसमें challenge कर रहा है. So that is option D. 91. When interacting with client, everything will be all right is an example of inappropriate communication technique, and it is known as, see the option, stereotyping, being judgmental, paraphrasing, using cliche. Okay, yeah, using cliche, because we don't know, right? Everything will be all right. It is a generalized phrase. We even don't know what will be the next sometimes, because treatment is dependent on many factors, on patient, on environment. जो साइकेट्रिक वार्ड में अगर तुम जाओगे ना, वो बहुत सारी चीजें के ऊपर डिपेंडेंट होता है. तो हम ऐसे फ्रेज नहीं यूज कर सकते कि एवरीथिंग विल बी ऑल राइट और लाइक दैट. सी, फ्रेज और आइडिया दैट हैज बीन यूज्ड सो मेनी टाइम्स दैट इट नो लॉन्गर हैज एनी रियल मीनिंग और इंटरेस्ट कॉल्ड क्लीचे. ओके, समटाइम्स मतलब हम दोस्त के साथ भी ऐसे बोल देते ना कि तू चिंता मत कर, सब ठीक हो जाएगा. ऐसे मतलब हम बहुत बार ये लाइन यूज करते हैं. मतलब पता नहीं बेमतलब कभी हम फील भी नहीं करते, हम यूज कर देते. तो इसको हम बोलते हैं क्लीचे. ओके. 92. A patient with antisocial personality disorder yells loudly. Okay. A staff member asks, do you know why people find you repulsive? This statement most likely would elicit which of the following client reaction? Option A, defensiveness. Option B, embarrassment. Option C, shame. Option D is remorseful. That is defensive. Okay, the nursing officer is being defensive. See, person with antisocial personality will not show shame, embarrassment and remorse because they are guiltless. So he will become defensive in response to above mentioned derogatory statement made by nurse. Next is 93. The attitude of a nurse towards a newly admitted patient in a hospital should be calm and friendly, task oriented, quick and hurried, cold and sympathetic. Okay. So न्यूली एडमिटेड पेशेंट के साथ कैसा होना चाहिए? सो वी शुड बी फ्रेंडली टू द पेशेंट एंड डील विद द पेशेंट calmly. Okay, that is option A, calm and friendly. Now coming to psychopathology. 94. A patient's effort to manage psychological stress is known as option A, secondary appraisal. Option B, coping. Option C, primary appraisal. Option D is distress. So that is coping. Okay. Thoughts and behavior mobilization by effort of person or by body self to manage internal and external stressful situation. That is called coping. Coping is categorized into 4 categories. Problem focused, it addresses the problem causing the distress. Emotion focused, it aims to reduce negative emotion associated with the problem. Meaning focused, individual uses cognitive strategies to manage the meaning of situation. Okay. Social coping क्या है? Support seeking, individual reduces stress by seeking emotional or instrumental support from their community. Clear? 95. Which type of coping strategy is most effective during a stressful circumstances that cannot be changed? Option A, emotion focused coping, avoidance, problem focused coping, coping flexibility. So that will be emotion focused coping. Coming to 96. Inability to verbally describe one's emotionally feelings. Option A, agitation. Option B, akinesia, alexithymia, then anhedonia. So that will be alexithymia. What is that? An impaired ability to be aware of, explicitly identify and describe one's feelings. It is often found in patients with child abuse. Okay, those patients who was a victim as a child, matlab who faced child abuse, then post-traumatic stress disorder, PTSD, drug abuse, and some somatoform disorders. Okay. Next, a patient has adequate speech amount but content provides little information. The patient is suffering from poverty of ideation, mutism, poverty of speech and echolalia. So that is poverty of ideation. मतलब क्या है? Patient क्या है? Provide adequate speech amount है but content में information बहुत कम है, तो उसको हम poverty of ideation बोलते हैं. Then excessive fatigue after minimal physical or mental exertion is option A, anorexia nervosa, bulimia nervosa, neurasthenia, dissociative disorder. Okay, so that is neurasthenia. What is that? A persistent distressing complaint of increased fatigue after mental effort, or persistent and distressing complaints of bodily weakness and exhaustion after minimal effort. Clear? So this is option C. 99. Decreased perceptual response to a repeated stimulus is known as habituation, selective attention, undivided attention, hallucination. So that is called habituation. Habituation is a process of becoming accustomed to a stimulus as a result of frequent exposure or use. 100. Immobile position that constantly maintained. Name the motor activities disturbance. That is C, dyspraxia, chorea, catalepsy, then echopraxia. So that will be catalepsy. Clear? A condition in which patient may appear to be in a trance or may assume rigidly held body posture without any movement. Next, temporary loss of muscle tone and weakness precipitated by a variety of emotional states is, so what is that? Cataplexy, catharsis, compulsion, confabulation. So that is called cataplexy. Cataplexy में क्या है? A sudden brief loss of muscle control caused by strong emotional response such as a hearty laugh, excitement, surprise or anger. क्या है ना, इतना मतलब स्ट्रॉन्ग इमोशनल रिस्पॉन्स के द्वारा उसका मतलब ब्रीफ लॉस ऑफ मसल कंट्रोल. ओके, Which term refers to perceptual abnormality? Option A, delusion, attention, hallucination, orientation. So that is hallucination. परसेप्शन में, एबनॉर्मलिटी में, हेलुसिनेशन, इल्यूशन, ये सारी चीज है ना. See, perception means identification and interpretation of sensory input or stimulus. See, first one it is written illusion. Next is hallucination. See, 103, the process to attend and react to a stimulus is known as perception, elaboration, interpretation and sensation. That is perception. To attend and react to a stimulus. 104, identification and interpretation of sensory input is option A, cognition, option B, affect, option C, perception, option D, judgment. So that is option C, that is called perception. Hallucination are disorder of perception. Imaginary perception is called, that is hallucination. Mrs. A frequently seen to lean her head to one side, cup her ear and move her lips when no one is present. She is most likely experiencing illusion, hallucination, delusion, obsession. That is hallucination. See, supposed to be she is experiencing auditory hallucination. She is experiencing some sound around surrounding without presence of any real sound stimuli in the surrounding. Okay. What is called an olfactory hallucination? Option A, false perception of vision, false perception of smell, false perception of sound, false perception of things. Olfactory का मतलब क्या है? We know it is something related to nose, so that will be smell. Okay. Which of the following hallucination is called false perception of joint or muscle sense? Visual, gustatory, visceral, kinesthetic. That is kinesthetic. Okay, joint and muscle they have told, right? 110, gustatory hallucination affects the nose, taste buds, ears, skin. So that is taste bud. Next one, false perception of taste is termed as, that is gustatory hallucination. The hallucination occurring in semi-conscious state before awakening is called as hypnopompic, pseudo-hallucination, hypnagogic, extracamping. That is hypnopompic. What is that? A transitional state from wakefulness to sleep. Hallucination of partial sleep associated with a semi-conscious state before awakening. It occurs in morning as we waking. Okay. During this, we are sensing things that are not actually happening while in state between dreaming and waking. Hallucination influences patient to take some specific action against others. It is known as command. Okay, someone is commanding. Clear? See, false perception of order, mainly verbal, that a person may feel obliged to obey, called command hallucination. It is mainly auditory hallucination. So don't get confused between auditory and command. You have to see the key word here. See, influence patient to take some specific action. They have already mentioned in question. That's why it will be more specific answer, that is command hallucination. It is under auditory hallucination. Okay. Hallucinations are seen in all except schizophrenia, seizure due to intracerebral space occupying lesions, LSD, anxiety. So option D. hallucinations are mainly seen in schizophrenia. Okay, bipolar disorder, example is mania. Drugs abuse like LSD, lysergic acid, diethylmide. Okay, a classical hallucinogen, and alcohol. Panic level anxiety may also cause hallucination. A mental disorder in which a person feels that lice are crawling on his arm, but actually there are no lice on his skin. The person is suffering from auditory hallucination, auditory illusion, tactile hallucination. So that will be tactile hallucination. अच्छा, बेसिक डिफरेंस बिटवीन इल्यूशन एंड हैलुसिनेशन क्या है? इल्यूशन में क्या है ना, देयर इज a stimuli present, but you are like your perception is wrong. Suppose there is a rope and you are thinking like that is a snake. So in real there is a rope, मतलब rope present है. Clear? कर सेम चीज hallucination में अगर बोलोगे there is no rope but still you are saying like there is a snake. So this is basically a visual hallucination. Okay, hope it is clear.